Hi everyone, welcome back to Mediplacebootutoring. In this video, we'll be covering about high yield anesthesia pharmacology. So here we will be going directly to the question which we have. That is, we have a graph which is depicting on the y-axis. There is the partial pressure of arterial blood of the anesthetic, and on the x-axis we have the presence of the time. So it is basically indicating the poorly soluble versus highly soluble gas difference. So the nitrous oxide, it is a poorly soluble gas, whereas drug A, it is a highly soluble gas. So what do we mean by poorly soluble and highly soluble gas? So as we can see, the nitrous oxide is having a rapid increase in partial pressure of blood. That is, after giving the nitrous oxide in the gaseous anesthetic form, it is quickly rising initially and then it plateaus. Whereas in case of drug A, there is a slow rise in the partial pressure of blood. That is, it is still rising slowly, and it is taking a longer amount of time to be saturated in the blood. So high blood gas coefficient is the thing which is relevant to drug A. That is, it is more soluble in blood and it takes longer onset of time to have its effect in the system. So we can say that it is slow equilibration with the brain. The onset of gas anesthetic depends on the solubility in the blood, and it is also called as the blood gas partition coefficient. So here we would be looking at the two types of classes which we have, that is poor soluble and highly soluble gas. In terms of poor soluble gas, we can understand it as a big molecule. That is, the blood saturates quickly, leading to the faster onset and rise in partial pressure. And in turn, if the blood vessel is saturated quickly, it would eventually saturate the brain as well quickly, and increase pressure speeds brain saturation. So the increased pressure in the blood vessel would lead to faster onset of saturation in the brain and decrease in the onset time. That is, the time it takes to have the effect is quicker in terms of poor soluble gases. Like in case of the previous example, the nitrous oxide had a faster effect. So this can be said as low blood gas partition coefficient, and due to it, the low blood solubility, it can be used in the three phases, that is the induction phase, maintenance phase, and the withdrawal phase. Due to the faster onset of action, the other example which we have is desflurane. These are the anesthetic molecules that are the larger and that is increasing the pressure in the blood vessel, and that is in turn increasing the saturation in brain quickly. In terms of highly soluble gas, there is increased blood gas partition coefficient. That is, they are taking longer amount of time to have their effect. So they are smaller molecules and the blood saturates slowly, leading to delayed rise in partial pressure in the blood vessel. So due to this delayed rise in partial pressure, there is decreased pressure and slows brain saturation and increasing the onset time for the brain to get saturated and having its effect. So the highly blood solubility have slower onset of action. Example is methoxyfluorine. Drug A, which we had, was the example of highly soluble gas due to the high blood gas coefficient. Nitrous oxide is also fat soluble. So here is just the graphical representation of how the gaseous anesthetic work. First, initially, it would enter the alveoli the anes from the gaseous anesthetic, and from the alveoli it would enter into the blood. So based on it, we would have the partial pressure of gas in alveoli and later in blood. And there are some factors affecting the partial pressure. So firstly, we have the inspired gas. It is directly proportional to the partial pressure of the anesthetic present in the blood. Then we have the amount of ventilation which is occurring. If there is hyperventilation, so would be the partial pressure be high due to the hyperventilation. In terms of alveolar exchange, if there is alveolar ventilation and perfusion, depends on alveolar ventilation and perfusion, and would be low if there is any case of VQ mismatch, or could be basically there would be a change in terms of VQ mismatch. It could be increased or decreased. In terms of blood solubility and tissue solubility are the also two factors which have an effect in terms of partial pressure of anesthetic. The blood gas partition coefficient, as we discussed earlier, the concentration of gas in blood upon concentration of gas, and later on the cerebral blood flow, that is how quickly or how slowly the brain is getting saturated. So here we have covered regarding the partial pressure of anesthetic and saw two examples regarding the highly soluble and poorly soluble gas. That is it for this video. If you like the video, please like, share and subscribe. If you have any doubts, let me know down in the comments below. Thank you.